Hello, welcome to Humane. Today we have Dr. Chetan with us, and today's topic is nervous weakness. Hello, doctor.
Hello, sir.
So tell us, what exactly is nervous weakness?
See, many patients have these symptoms like what? They have thread like pains, pulling pains, dragging pains in their hands, in their legs. These are nervous weakness symptoms. And some have pain in their palms. They have numbness in their palms, burning sensation in their palms, burning sensation in their feet. So, these are all symptoms of nervous weakness. A patient had come to us who was having the problem of vertigo. In short, actually, nervous weakness is not a particular disease like how we have diabetes. It is not a disease, but it is a finding. It is like a symptom, more of a symptoms which is present in many disorders. Now we have diabetic neuropathy. In diabetic neuropathy, peripheral nerves, for example, nerves in the feet, nerves of the lower limbs, nerves of the palms get weak due to uncontrolled diabetes. At that point of time, these patients start having tingling in their arms, tingling in their feet, and moreover, also there are diseases like cervical spondylosis, lumbar spondylosis, where the spinal cord is compressed many a times. Here also you have these symptoms like symptoms of vertigo, again numbness, dragging pains, pulling pains, where the patient is not able to bear the intensity of the pain. What happens in many patients when they lie down, when they turn this side and that side, they have that dizziness in them, and these are symptoms of nervous weakness. Moreover, let us understand what nerves are. So we have a nervous system in our body. What this nervous system does, it supplies nerves to every part of our body. Now we have our palms. When I touch my finger, I can have a sensation, a feeling that something is being touched to my finger. So this is a sensory response of the nervous system. That means the nerves in my fingers are acting properly, are functioning properly. But in some times, in some cases, in some situations, this changes because of an underlying causative factor. It can be diabetes, it can be hypertension, it can be peripheral neuropathy, it can be diabetic neuropathy, it can be lumbar spondylosis, it can be cervical spondylosis, which causes these symptoms. Nerves are like wires in our body. Nerves, they are like wires. Many of us know that our body itself runs on electricity. When these electric impulses are disturbed, we have these symptoms of nervous weakness.
So, how exactly does homeopathy treat this problem?
For example, we had a case around 2 or 3 years back. That patient was suffering from diabetic neuropathy. She was not able to stand properly. Whenever she would stand, she would have something like a shock passing in her lower limbs. She would have that sensation. Moreover, she had backache also, and she was having dragging pains in her legs. These were symptoms of lumbar spondylosis, and also she had peripheral neuropathy, which was due to diabetes. We started treating the patient. We had taken a total case history of the patient, like from when it started, what are her thermals, that is, when is she feeling better? Is she feeling better when she's in a hot environment, or she's feeling better when she's in a cold environment? We consider symptoms in a very detailed manner when prescribing homeopathic medicines. And this patient had also expressed that she was having dreams of falling from heights while sleeping, and this was from almost 4 to 5 years. So we took that also into consideration. See, homeopathy is a holistic system of treatment, and while treating the patient, we consider the symptoms of the mind, we consider the symptoms of the body, we consider the generalities, that is desire of the patient, aversion to what kind of foods is he or she averse to, how is the sleep of the patient, what kind of dreams does he or she get, and based upon that we prescribe. But in general, if people have these symptoms of nervous weakness, they want to experience homeopathy, they can start taking one medicine, that is causticum 10m, in pills form. Every day 5 pills they need to take, and over a period of time they'll find some relief. If they want further relief and totally want to reverse their problem, they can consult us for treatment.
So, could you please tell us some home remedies for this problem?
I would tell a very good home remedy for this problem. See, many of us have green tea. While having green tea, add a little cinnamon powder to it. When you add cinnamon powder to it, what happens is you don't need sugar, because cinnamon itself gives a sweet kind of taste. And then cinnamon and green tea both have antioxidant properties, and both have analgesic properties, both have anti-inflammatory properties. What they do, they reduce the inflammation that is there in the nerves. They reduce the swelling if there is any in the nerves, because inflammation will happen in the body when there is some disease. So that also they help in reduction. And they have antioxidants. When there are free radicals in the body, they help in reducing these free radicals. In that way, it also helps in controlling diabetes and also reducing the nervous weakness problems in the body.
So thank you, doctor, for enlightening us about this problem and also sharing the remedies and medications for the same.
Thank you, sir.